You've heard about thirst, fatigue, and peeing all the time. But what if your diabetes was hiding behind something strange like stiff fingers, a frozen shoulder, or even skin tags? The truth is, diabetes doesn't always scream. Sometimes, it whispers through unusual signs your body is begging you to notice. Today, we're breaking down 12 unusual symptoms that could be your body's silent cry for help. Some are weird, some are serious, and all of them are worth knowing. Let's dive in. 1. Frequent infections, abscesses, yeast, or UTIs. If you're getting repeated yeast infections, painful urinary tract infections, or even unexplained abscesses, your blood sugar may be to blame. High glucose levels weaken the immune system and feed bacteria and fungi, turning the body into the perfect breeding ground. 2. Gastroparesis. Your stomach slows down. Ever feel full after just a few bites? Or nauseous with bloating that won't go away? That could be gastroparesis, in which high blood sugar damages the nerves that control the stomach muscles, slowing digestion and leaving food stuck in the gut. 3. Peripheral neuropathy, the nerve pain monster. This one's more well-known but still often dismissed early on. Tingling, burning, numbness, or stabbing pain in your feet and hands might seem random, but it's often the first clue of nerve damage from chronic high sugar. It starts subtly, it gets loud, and it doesn't reverse easily. 4. Acanthosis nigricans, the neck darkening clue. Dark, velvety patches around the neck, armpits, or groin might look like dirt or irritation. But this skin change is a classic early sign of insulin resistance, when your cells stop responding appropriately to insulin, and sugar builds up in your blood. 5. Diabetic stiff hand syndrome, limited joint mobility. If you can't flatten your hand on a table anymore, or your fingers feel tight and waxy, you may have diabetic stiff hand syndrome. It's caused by changes in the skin and connective tissues, making hand movements painful and stiff, especially in long-term diabetes. 6. Skin tags, tiny growths that tell a big story. Skin tags are soft, harmless growths that often appear on the neck, eyelids, or armpits. But in people with diabetes or insulin resistance, they're more common. They're not just cosmetic, they could be a sign your insulin levels are spiking too often. 7. Frozen shoulder. And no, it's not just from aging. If your shoulder suddenly becomes painful and hard to move, it could be frozen shoulder, also called adhesive capsulitis. It's more common in people with diabetes and may be due to inflammation or reduced circulation in the shoulder joint tissues. 8. Diabetic foot infections, a dangerous oversight. Minor cuts, calluses, or even dry skin on the feet can lead to serious infections in people with diabetes, especially when nerve damage prevents them from feeling pain. Left unchecked, it can lead to ulcers, abscesses, and in some cases, even amputation. 9. Charcot foot, the silent foot collapse. Imagine your foot collapsing from the inside. That's what happens with Charcot foot, where damaged nerves lead to microfractures, deformities, and joint destruction, without the person even feeling it. It's rare but devastating, and almost always linked to uncontrolled diabetes. 10. Trigger finger, when your finger gets stuck. If one of your fingers catches or locks in a bent position, you might have trigger finger, a condition where the tendons in your fingers get inflamed and tight. It's more common in diabetics and may be related to glycation of tissues from prolonged high blood sugar. 11. Gum disease or dry mouth. High blood sugar affects your oral health too. Dry mouth, Inflamed gums, loose teeth, and frequent gum infections are red flags. Elevated glucose promotes bacterial growth and weakens gum tissue defenses, setting the stage for periodontitis. 12. Hearing loss or ringing in the ears. Tinnitus. You probably didn't see this one coming. People with diabetes are more likely to experience hearing loss or ringing in the ears, possibly due to damage to the inner ear's tiny blood vessels and nerves. It's subtle, but it matters. How is diabetes diagnosed? Diabetes is diagnosed through blood tests. Fasting. Blood glucose greater than or equal to 126 milligrams per deciliter. Hemoglobin A1C greater than or equal to 6.5. Oral glucose tolerance test greater than 200 milligrams per deciliter at 2 hours. Or random glucose greater than 200 milligrams per deciliter with symptoms. Often, multiple tests are used for confirmation. Who should be tested? According to the American Diabetes Association, testing is recommended for all adults age 35 and up, every 3 years, anyone overweight or obese with one or more risk factors, e.g., family history, PCOS, hypertension, sedentary lifestyle. Pregnant women during weeks 24 to 28 are at risk of developing gestational diabetes. People with prediabetes should be tested annually. Types of diabetes. Type 1 versus Type 2. Type 1 is an autoimmune condition in which the pancreas does not produce insulin, resulting in insulin deficiency. It often starts in childhood but can occur at any age. Treatment is lifelong insulin. Type 2 is more common and involves insulin resistance. Your body still makes insulin. It just doesn't use it well. It's often linked to lifestyle, weight, and genetics. Can it be prevented? Type 2 diabetes is often preventable or delayable with weight loss. Even 5 to 10% helps. Regular physical activity, healthy eating, low refined carbs, more fiber, managing stress and sleep, avoiding tobacco. Current treatment approaches. Treatments depend on the type and stage but include lifestyle changes, diet, and exercise. Metformin as first line for Type 2. Other meds: GLP-1 receptor agonists, SGLT2 inhibitors, DPP-4 inhibitors, insulin therapy for Type 1 and advanced Type 2, blood pressure and cholesterol control, foot care and eye exams to monitor complications. The goal? Keep blood sugar in the target range and prevent damage before it begins. These symptoms might seem strange or unrelated, but together they could be the missing puzzle pieces of undiagnosed diabetes. If you or someone you love is experiencing any of these signs, don't ignore them. Diabetes is manageable, but only if you catch it early. Know the signs. Get tested. Take control. Thanks for watching.